Assalamu alaikum wa rahmatullahi wa barakatuh. Okay, we thank you very much, Dr. Afa, for this presentation. It was very nice. I liked where you have presented in all advancements in categories. So let me just try to do this. Okay, so you talked a little bit about the background, then you went to the OST integration. The methodologies are excellent. Some methodologies I could not understand. For example, surface suitability. You improved it, but how did they do it? Yani, for example, when you talked about photo and functionalization, you talked about what did they add. Okay, so but surface suitability improvements, what did they do to increase suitability? Just if you can add that, please, further explanation. Okay, you talked better then about the recent advances in dental material implants. Also, that was beautiful and was fine presented. But in the end of it, if there are any systematic reviews giving the results, we need systematic reviews to sum up these. Okay. So try to find more systematic reviews comparing between these new material. In terms of abutments, you talked about the customized abutments, and that was very interesting, and you talked about them. There was a study in our school done by Dr. Saleh. If you can add that would be beneficial to add our colleagues' work into the presentation. They had done some work on the fracture resistance. All of these new materials and hybrid abutments, you talked about them. As I told you, because he is more, Dr. Saleh went through these materials and hybrid abutments more than I did. I would also add, inshallah, later on, his comments on this presentation. What does he like to be added as well? So it would be excellent to use his expertise with us. Then guided implant surgery was beautifully illustrated and it was clear, very clear. And I hope you enjoyed it as I did. So the dynamic navigation systems were interesting, something very new. Okay, the comparisons between them. I love this work where you talked about the workflow for guided implant surgery. How would you do that and how to incorporate the CBCT into the software to be used in the guidance. Okay, and how do they do the guides? Digital Smile, you talked about all on one of the steps of, or let's say workflow for one of the systems, what they did, how did they do it? And then you finished. This is where I was a little bit disappointed. I wanted more of this beautiful presentation. So I was thinking that you might have talked about something about what tissue engineering is done, not only the implant itself. What about the surgery? What are the procedures done in the soft tissue around it to increase the outcome or the prognosis of that implant? What are new theories in implant as, for example, immediate implants? Have there been any advancements on the recommendations for that?
Okay, I would add them, Dr. Ali. Because you took a course for implantology before, so I thought it might be appropriate to save time for the prosthetic part of the implant.
No, I'm talking about only advancements, only things that have been added to such course. I know you took an implant course, but has there been something new in the guidelines regarding when do I do an immediate loading, for example? Also as well in the correlation with the occlusion, are there any stuff that are new? I was expecting to see a lot about mini implants and their applications. The new applications of mini implants, or what they call pens. How do they aid in ortho treatments? How do they aid? So all of that line as well. So what is the function of mini implants, pens, what they call pens for surgeries to guide, to aid ortho, to aid rehabilitation after resective surgeries, whatever if you could put a section on implants that are done for other reasons other than direct restorative, okay, procedures. So that would be a beautiful thing to add, because your presentation was beautiful and I wanted more about that. So to cover further issues. Okay, as well, are there any disciplinary collaborations? Who are you going to collaborate? Are there anything new teams that you can add? You might talk about implants in some of the cases where we have, for example, cleft lip and palate anomalies and so on. What are the applications there for implants? So even maxillofacial implants, just mentioned that we have for maxillofacial rehabilitation. Okay, any new guidelines on the systemic medications or systemic diseases that we should have? Okay, so any new guidelines? For example, in some time there were some drugs that are limited. You cannot put implants. Diabetes was one of the diseases that was a limiting factor to placement of implants. Smoking as well. What are the new guidelines? For example, when do you warfarin, for example, in relation to implant placement? So all of these systemic diseases or medications or any alterations inside the oral cavity for those specific patients. Okay. Also, they did not talk about implants around teeth. Most of what you talked about were implants are by themselves. But what about implants in terms of relations with adjacent teeth? Are there any advancements in the recommendations in terms of location, position, fixation, any recommendations around that area? That would be beautiful. And some of the surgical procedures soft tissue procedures that are placed around implants as well. Grafts, guided tissue regenerations, stem cell therapies to add in regeneration of tissue around the implants. So all of these, and treatment of peri-implantitis, things that can be done other than the actual treatment itself. So all of these, because everybody is very excellent in placing implants nowadays, but what happens if the implant is failing, or can you halt the failure? Can you control peri-implantitis not to lead to a failure? So all of these issues, okay? What are the recommendations in terms of the depth of the implant placement in terms of bone? What is the final recommendation, the most advanced guideline for that? How much can I go crystal, or do I need to make it superficial? And so a little bit about bone grafting around implants as well. So all of these, the presentation was excellent, but it only was on one subject, which is the implant itself. No, we need the implant in relation to whole mouth rehabilitation. Okay, you talked about the upper, you didn't talk about the lower. In terms of all the theories of how many implants do we need, what is the minimum requirement, what are the recommended treatment of overdentures versus fixed, meaning removable versus non-removable prosthesis over these implants. Any new guidelines about these? Just, I know that I gave you a large number of subjects, but all of them is like one or two, the most advanced recommendation. Okay?
Yes, okay.
Yeah, I need to make this more comprehensive to make sure that you are not missing on any advancement. And once more, we're not talking about what's present in textbooks, not what you took in the implant course. No, we're talking about something that will be missing from those with regular textbooks content. We're talking about something more advanced than the regular textbook subjects, okay? Especially, and I'm talking today about stem cell therapies around implants. Those are a huge topic now. Grafting material is another huge topic. So if you just mention them here, but these also should be in the lecture about other specialties in relation to prosthodontics. So whenever I'm going to talk about perio-ortho in relation to prosto, this should be further mentioned in detail. Your aim is only just mentioning them with the most advanced techniques or procedures done around implants with them. The details, we'll get them later, inshallah. Thank you very much. Please excuse my voice. It's not helping me today. And we'll see you, inshallah, next time. Thank you very much. Looking forward to the next presentation.
يعطيك العافية دكتورة.